Hey everybody, welcome back to another episode of Facebook Live. We're here tonight at Strawberry Crest High School as it serves as the home field for the Seffner Christian Crusaders as they take on the Cambridge Christian Lancers. Both schools are served by the official team physician, none other than our very own sports medicine shoulder and knee specialist, Dr. Christopher Baker. Dr. Baker, how are you today?
I'm doing well, Kyle. Thanks for having me.
Dr. Baker, last time we spoke about some of the more common knee injuries and knee pain that you see on a day-to-day basis. So we wanted to take some time to talk about the other side of that equation and talk about some of the more common reasons that you see patients on a day-to-day basis related to shoulder pain. So what kind of reasons are you seeing for shoulder pain?
Well, shoulder pain is a pretty common issue in our clinic. The most common reason by far is simply just tendonitis, inflammation of the shoulder basically. The next most common reason would probably be a rotator cuff tear. After that would probably be something along the lines of shoulder arthritis. And then probably after that would be dislocations in the shoulder.
So Dr. Baker, you said shoulder tears, rotator cuff tears. Are we seeing a lot of rotator cuff tears in our student athletes? What's the difference between a tear and something more like a shoulder sprain or a shoulder strain?
So we'll start with the second part of the question first. Sprains and strains generally mean a stretching of the tendon and the muscle without a complete tear. That's usually what people are referring to when they say that. Sometimes there's confusion in the language. When you get to a tear, that's where the bone has actually been separated from the tendon or the muscle itself has been ripped into two pieces. So a strain generally is considered to be a lower degree injury, whereas and a sprain as well, whereas a tear is generally considered to be a higher degree injury. When we're talking about athletes and it comes to tearing, especially of the rotator cuff itself, we really don't see too many rotator cuff tears, especially in kids. Once we start getting upwards of the age of 40 plus, that's really where the rotator cuff tear population comes. So a lot of parents bring their kid to me, or young adults will come to me for shoulder pain, and they're concerned that they have a tear of the rotator cuff, and it's almost unheard of to be seen in a younger person.
So with that said, if one of our athletes had a rare tear, how would they know that they tore something in their shoulder versus if they strained or sprained something? Would they feel something different? Would something pop or click or just feel a little bit off than it would with a strain or a sprain?
Well, in anyone with a tear versus a strain, both are going to have pain. In a true tear, usually there's going to be some pretty significant weakness. There are commonly even mechanical symptoms of as they try to lift the arm, they'll feel a click and a clock inside it. The more common tear that we see in young kids is more of a labrum tear, and there's kind of generally two varieties of that. One is called the slap tear, which is on the top part of the shoulder, and that's where the biceps tendon kind of pulls on the labrum or the lining of the shoulder. The other most common tear of the labrum is an anterior dislocation or a labral tear in the front, usually. There's also posterior related ones which can happen in kids this age. Usually kids that are heavy bench pressers, down linemen and stuff, they can get posterior labral tears, and again they'll get clicking and popping inside the shoulder as well.
So with all those different kinds of tears, what's the treatment process like? Is it all surgical? Is it all non-surgical? Do patients have options?
So when it comes to the rotator cuff, basically age is kind of the big determinant of how we manage that. The younger the patient is, the more active they are, the more likely we are to end up operating on that type of a tear. As patients get older, 70s and 80 years old, we really try to do non-operative management. Those patients generally get a cortisone shot, a little bit of therapy, and the vast number of them, probably 75% plus of them, will get better with just conservative management. When we're talking about labral tears, which is inside the shoulder, not the rotator cuff, but the lining of the joint, if the kid is dislocated, they're more likely to get surgery. If there's something called a superior labral tear or a slap tear, those can commonly be treated with an injection as well and some therapy. Posterior labral tears are also along that lines as well, more conservative management.
So after the pain management and after successful treatment of a shoulder injury, sprain, strain, or tear, can our athletes ever compete at that same peak level that they were before their injury? Will they ever get back to 100% again?
Absolutely. Again, depending on what type of a tear we're talking about, what level of activity, what quality of tissue we have, most rotator cuff tears can be repaired and get the patient back to whatever activities they were doing beforehand. Labral tears are the same way. Common injuries in football and soccer and lacrosse, those kinds of things. Shoulder dislocations, we repair that ligament, it heals in, the kid can get back to their sport. Superior labral tears, also very good high return rate. Posterior labral tears, very high return rate to sports.
All right, Dr. Baker, thank you so much for being here tonight. Thank you for dedicating your time and your efforts as you're going to have a busy night tonight. You're the official team physician for both schools playing tonight, so thank you so much for being here.
Hopefully we won't be busy. Go both teams.
Everybody at home, thank you for tuning in. Keep staying tuned in, and we will stay keeping you active. Thank you. Have a good night.